Dear viewers, I hope you are all fine. This ultrasound video shows a fetal demise in early pregnancy. The pregnancy just above the 13 weeks. Fetal demise in the womb is confirmed by an ultrasound scan. Ultrasound scan is able to show if the baby's heartbeat has stopped. Sometimes after it has been confirmed that the baby has died, you may still feel as if the baby is moving. You can see the fetal head and the placenta. In case of fetal demise, a dead fetus that has been in the uterus for 4 weeks can cause changes in the body's clotting system of the mother. These changes can put a woman at much higher chance of significant bleeding if she waits for a long time after the fetal demise to deliver the pregnancy. You can see there is soft tissue edema in the fetal head. No blood flow is seen, and there is no fetal cardiac activity. This is the fetal heart, and there is no fetal cardiac activity visible. The term early fetal death refers to conditions in which the fetus is no longer alive, but the uterus has not yet started to expel its contents. A variety of terms were previously used to describe this condition, including blighted ovum, missed abortion, and silent miscarriages. Miscarriage is a word used to describe the early loss of pregnancy before 20 weeks of pregnancy. It usually happens in the first trimester. Unfortunately, about between 10 and 15% of known pregnancies end in miscarriage. Now you can see there was no fetal cardiac activity. There are 3 hypothetical causes of fetal demise in first trimester. Number 1 is parvovirus fetal infection. Primary viral infection of the myocardial cells initially causes myocarditis, leading to hydropic cardiac failure and demise. Number 2, bone marrow transit aplastic crisis occurs as a primum movement for anemia, leading to the sequel of congestive heart failure, hydrops, and fetal demise. Then placentitis without fetal infection causes placental dysfunction and ultimately fetal demise. Again, you can see there is no fetal blood flow seen in the fetal heart or in the umbilical cord. There is soft tissue edema. An inability to obtain fetal heart tones upon examination suggest fetal demise. However, this is not diagnostic and death must be confirmed by ultrasonographic examination. Fetal demise is diagnosed by visualization of fetal heart and the absence of cardiac activity. Now again you can see the fetus with no fetal movements, no blood flow, and no fetal cardiac activity. Fetal demise in womb is confirmed by ultrasound scan. Ultrasound is able to show if your baby's heart had stopped beating. Sometimes after it has been confirmed that there is fetal demise, pregnant woman may still feel as if the baby is moving. Now the causes of fetal demise: placental abruption and other placental disorders such as vasa previa, placental dysfunction leading to fetal growth restriction. The term early fetal death refers to condition in which fetus is no longer alive but the uterus has not yet started to expel its contents. A variety of terms were previously used, including blighted ovum, missed abortion, or silent miscarriages. Women who retain the dead embryo fetus can experience severe blood loss or develop an infection of the womb. There are rare complications. Some babies die in the uterus womb before they are born, called intrauterine fetal death. It can happen during the last half of the pregnancy also, and more rarely during labor and birth, when it is known as intrapartum death. When the baby who has died during labor and birth is born, this is called stillbirth. Now, the etiology of the fetal demise. There are maternal causes: gestational hypertension, blood group incompatibility, metabolic disorders, intrauterine infections. Then there are fetal major anomalies: umbilical cord complication, looping, knotting, twisting, and straight cord. Then there may be placental causes: chronic placental insufficiency, placental abruption, chorioamnionitis. Ultrasound features of fetal demise are absent fetal heartbeat, absent fetal movements, and blood flow is also invisible. Occasional findings are overlapping of skull bones, Spalding sign, gross distortion of fetal anatomy, maceration, soft tissue edema, that is more than skin edema more than 5 millimeter, then echogenic amniotic fluid, fetal demise fragments. Then there are uncommon causes including thrombus in fetal heart and gas shadow in fetal heart called Robert sign. You can see the fetal head and it shows the soft tissue edema. And you can see the large placenta is visible. This is soft tissue edema on the fetal skull bones. You can find some important information in the description of this video. Thanks for watching. Please subscribe my channel. If you do like this video, please click the like button. Thanks.